It's 105 degrees in Gudlavaleru in southwestern India. And Raman, a 6-year-old boy, steps up to a microscope and takes a look. He looks down and sees hundreds of tiny worms squirming through the water and recoils in disgust as the 300 members of his family and friends and classmates all start laughing. He takes another look at another slide through the microscope and sees still clean water and asks Raj, who's standing behind him, what the difference is between these two. Raj explains that the first sample is the sample of drinking water that Raman brought from his home, the water that Raman's family drinks every day, whereas the second is a sample of the water from the Water Health Center, which is just down the road. So I'm here to talk about innovation like the rest of you, and you may be thinking that the innovation that I'm going to focus on is the innovation of the Water Health Center. This is an amazing innovation through using UV technology, able to purify drinking water to make it affordable for families like Raman's. And while that is an amazing innovation, that's not the one that I'm focused on. The innovation that I'm focused on is this program that Water Health International has developed to both embrace the communities where their water health centers are based and inform families like Raman's about the importance of drinking safe water. So you may be wondering, how is it that Water Health International has been able to address this really complex issue of behavior change when so many organizations before them have failed? This is an amazing innovation because they have been able, through this program, they've been able to increase the customers at the Water Health Center by about 4 or 5 times over the course of just a couple months. And they've now rolled out this program to 20 villages across southern India and are looking to expand to another 100. This has meant that thousands of families like Raman's, their children are no longer suffering from chronic diarrhea, and they're able to go to school every day, and their parents are able to go to work. So Water Health International has been able to succeed in this issue of behavior change because they've embraced this approach of human-centered design. And there's 3 pillars of human-centered design that I wanted to talk about today. The first is around empathy, really understanding your customers and the user's needs and designing solutions for them. The second is the importance of developing market-based or sustainable approaches. And the third is about identifying and then spreading local innovation. So this story of human-centered design is one that's very close to my own story. I work at IDEO and lead our social innovation domain, where we're working with social enterprises, nonprofits, foundations, and companies looking to enter emerging markets in socially responsible ways. We're working on projects ranging from designing eye camps for children in rural India to distribution networks for low-cost hearing aids, working with mobile phone services providers on programs to address disaster situations, and low-cost technologies for farmers to irrigate their land. So this story mirrors my own, and actually my story with human-centered design began with me shoveling shit. So when I was 12, I spent some time volunteering for Heifer International, and I was working in the pens cleaning out the stalls of the goats and the cows, and while I was completely disconnected to the reality of what was going on in Malawi, where the livestock were ultimately going, this was my first exposure to development, and it allowed me to really get my hands dirty and get into this work. Next, I worked and did some volunteering work for Habitat for Humanity when I was in high school, and it was here that I really learned this lesson of empathy. I had an opportunity to work alongside the mother in rural New Hampshire as we were building her house and could really see the importance of understanding the needs of her family and then designing a house that actually met those needs. I went to college and studied anthropology, and while I was there, lived in Barcelona with a Catalan family and spent time studying the complexities of Catalan identity. And really, in retrospect, this training in anthropology has been really beneficial to me today in terms of my role as a designer of understanding how people think and act and how to interpret their cultures. So I was off to Washington after college. I decided I wanted to change the world, and what better place to go than to Washington, where I could focus on doing international development work. I was working on big government-funded projects with budgets in the millions of dollars, and I thought that surely we would be able to make significant impact and change with this much money. I was flying all over the world, and it was really exciting to travel, but the funny thing was that I would spend a couple weeks someplace and realize that I actually hadn't learned anything about the place where I'd been. I was staying in 5-star hotels and working in conference rooms, and it wasn't really until I experienced my Bolivian bus story, which unfortunately I don't have time to go into today, but suffice it to say that it included 22 people in a 15-passenger van, 4.5 hours, no air conditioning, bumpy roads. And this was the time that I really understood the importance of getting to know the people that you're working with, and that doing development based on the needs of others, talking to them, understanding that situation before recommending these solutions from afar. So I left Washington after 5 years, committed to doing development work, but totally disillusioned with the way that I had seen it done, looking for new approaches, and went to business school. I'd been there for about a week when a couple of my friends and I discovered the World Economic Forum and the Schwab Center for Social Entrepreneurship. This was in 2004, and as some of you may know, these were still relatively early days in the whole social enterprise movement. But I was blown away, thought that this was certainly the answer, and so decided I needed to learn more. So I went to India and worked for an organization called Vision Spring. Vision Spring is a social enterprise that buys reading glasses for about $1 a pair from China, sells them to vision entrepreneurs, typically women who are micro-franchisees, for about $2 a pair. And then the women in turn sell them to people, tailors, weavers, jewelers, people that need to be able to continue to see up close after the age of 40 for about $3 a pair. So this is where I really learned about that second pillar of human-centered design, the importance of creating sustainable, market-driven approaches and using innovation and applying it to business models. Towards the end of my time in India with Vision Spring, I met two people who would significantly influence my life. Jocelyn Novogratz, the CEO of Acumen Fund, and Tim Brown, the CEO of IDEO. With my day in the field with Jocelyn and Tim, I was really able to see them embody this approach of human-centered design in the way in which they were interacting with the people in the village that we visited. So I, like many people, was blown away by this approach of Acumen Funds and Jocelyn's, and went to work for Jocelyn as an Acumen Fund Fellow after business school. There, I went to Kenya and worked there for about a year with an organization, one of Acumen's investees, called the Sustainable Healthcare Foundation. And it was here that I learned really the importance of the third pillar of human-centered design, identifying local innovation and spreading it. So I spent some time with this man, Ibrahim, who was a community health worker. Ibrahim would travel around village to village, explaining to women the importance of sleeping under bed nets to avoid malaria and how to treat them with this insecticide. The organization looked to Ibrahim to be able to tell the other community health workers how to best educate people about the importance of this malaria treatment. They were able to reduce the rates of malaria so significantly, and it was really a result of identifying and then spreading this local innovation that Ibrahim had developed. So just to recap, in terms of my journey towards human-centered design and understanding those three pillars, I first understood that empathy through my work with Habitat for Humanity and working alongside a woman in rural New Hampshire, and then also on the Bolivian bus ride, understanding the local situation for the first time after years of doing this development work. The importance of market-based or sustainable approaches and business innovation in terms of this poverty alleviation work with my work with Vision Spring. And then finally, the necessity to identify local innovations as opposed to opposing them from the outside in through my work with the Sustainable Healthcare Foundation. So I needed to find a place as I was leaving Kenya where I could apply all of these things, and was able to reconnect with Tim Brown and found myself at IDEO about 2 years ago. So one of the projects that we've been working on in our social innovation domain is this ripple effect project that I alluded to at the beginning of my story. Ripple Effect is a project that we're doing in collaboration with Acumen Fund, where we're working to seed innovation within the water sector. We've worked with 22 Indian and Kenyan organizations to help them understand the needs of their customers and then design innovative approaches to meet those needs to really increase the uptake of clean drinking water. This project is on the road to impacting 500,000 people and is continuing in Kenya today. So what's been exciting is that while we've been able to work with many of these organizations directly, we're just unable to work with all of the social sector organizations that could really benefit from this approach of human-centered design. So to address that, we've developed the Human-Centered Design Toolkit as a way for organizations throughout the world to be able to take up and understand this approach and apply it to their own organizations. So this approach of human-centered design is now being taken out of the hands of designers and put into the hands of practitioners as well, so that it can really spread throughout the world. And so this is a story, not just of my own story, but a story of a movement towards human-centered design. And what we're seeing now is that thousands of organizations throughout the world are really being able to better understand the needs of their customers and then design solutions to support those needs, and that these solutions are truly changing the world. Thank you.